Hello everyone, this is me Dr. Harun. Today I would like to describe the ABG or arterial blood gases. So we have different kind of the gases in our blood like oxygen, carbon dioxide. So due to that, if any abnormality happen in that gases, different condition will be happen and we have to look for the ABG. So we would like to test the patient ABG or the arterial blood gases. So for the arterial blood gases, normally we take out the blood from our arteries, not from the vein. So normally we take out from the radial artery or from the femoral artery. So and then we will check and look out for the gases, and we will be measure that, and by that we will be find out the conditions that which condition happen in our body. So before we start, I would like to tell you, I will be described completely ABG, and at the end we will practice 10 cases, and that will be very helpful for everyone to find out how can we find out the respiratory acidosis or respiratory alkalosis or metabolic acidosis or metabolic alkalosis. So if we carefully watch the videos up to end, I will sure that you will be completely or 100% know about the ABGs at the end. So if we look to the normal value of the ABG, every doctor, they have to memorize the normal value of the ABG. So we have these parameters for the ABG. So every doctor, they have to learn, they have to memorize this value. If they don't, at the end when we practice on a cases, so in that condition, you will be faced to a challenge and you will be not find out the condition. In most cases in a PLAB, so they will be not give you the normal value. So when they not give the normal value, that will be difficult situation for you to find out that which value is normal and which value is abnormal. So due to that, you have to memorize this. So we have these parameters to check the ABG, and to find out the conditions, we have to look for these parameters. What is that? First, pH. Normal pH is between 5.35 up to 5.45. This is the normal value. You have to keep mind this in your brain. Secondly, partial pressure of the oxygen. Normally it is between 10.7 up to 13.3 kilopascal. And partial pressure of the carbon dioxide is between 4.7 up to 6 kilopascal. And bicarbonate level is between 22 and 28 millimole per liter. And the lactate is 0.5 up to 1. So this is the normal value. Just look out here. We have two different units that we use in ABG. Sometimes we use kilopascal, sometimes we use millimercury. So we have to memorize this one as well. Just it's normal, but the unit of the measurement is different. So pH is that once 7.35 up to 7.45. The partial pressure of the oxygen here is 80, between 80 up to 100 millimercury. The partial pressure of the carbon dioxide is 35 up to 45 millimercury, and the rest is same. So just here is different. We use here millimercury, but here we use kilopascal. So you have to memorize this too as well. Now, if any abnormality happen in this parameters, 4 condition will be happen in our body. If any abnormality happen in this parameter, 4 condition might be happen. What is that 4 condition? Here, maybe the patient faced to respiratory acidosis. Maybe in a patient develop respiratory alkalosis. Maybe patient have metabolic acidosis, and maybe patient have metabolic alkalosis. So these 4 conditions happen in our body due to any abnormality happen in this parameter. Don't panic. So at the end of this video, you will be completely understand and you will be completely find out when you read this parameter, you will be find out which condition is. So I would like to tell you one extra thing here. We have two different systems in our body that they control our ABG. The one is the respiratory system and the second is kidney system. So these two systems normally working together and they control our ABG. Like, I will give you one example. Like, due to respiratory system, acidosis happened. Any condition. So due to that, one condition that respiratory acidosis happened and respiratory system is involved. So in that cases, kidney try to compensate that condition. But in some situation which kidney is involved, kidney is the cause of the alkalosis or the acidosis, in that condition, respiratory system will be try to compensate that abnormal condition. So we call it that condition compensated. And compensated will be happen in three ways. Maybe the system not compensate, they will be just leave it, and we will call that uncompensated. Maybe the other system, the second system, try their best to compensate that, but they cannot compensate that completely. So that's why we call that partially compensate. And if the second system compensate that condition completely, so that will be called fully compensated. Don't worry, at the end, when we practice on a 10 cases, you will be completely know about compensated and uncompensated. So now we look for the acid-base balance here. As I said, the normal pH level is this one, 7.35 up to 7.45. So this is a normal. If the pH is going down, the value is going down like 7.28, the condition which is happen in our body, that will be generally called acidosis. If the pH level is going up more than 7.45, like 7.55, so generally we call that alkalosis. So just by one read of one parameter, you will understand that is it acidosis or is it alkalosis. But if you want to find out more that which system is involved, we have to go forward. So imagine you find out the pH is, maybe you find that a pH is alkalosis or acidosis. So you determine that. Next, you have to find out, is it the respiratory system involved or metabolic system is involved. So you have to read more, and you have to read more parameters to find out that conditions. So I read one system here, like pH is less than 7.28, and I know that's acidosis. And now I want to find out, is it respiratory system or not. So see here, respiratory. In respiratory, that will be two conditions happen. Might be acidosis and might be alkalosis. How will be approached? Like as I described to you, in acidosis, the pH will be decreased. So the pH is decreased. What other parameter will be decreasing in respiratory acidosis? Look to partial pressure of the carbon dioxide. And we know that if the carbon dioxide level is going up in our blood, in our body, so the pH will be going down and the condition will be acidosis. But if the carbon dioxide level is going down, we will be know that the pH level is going to alkalosis side. But here respiratory acidosis happen, so the carbon dioxide level will be raised. So pH is down, carbon dioxide is raised. I will give you one example. One patient is coming to you and that has a COPD, and we know in COPD, we know the airway is narrowing. There is some abnormalities, some pathologies, and the way is narrow. So when the patient inspirate, less oxygen will be going to lungs, and when the patient expirate, so less carbon dioxide will be going out, and due to that the carbon dioxide will be accumulated in our body and that will be raised, and due to that respiratory acidosis will be happening. But what will happen in respiratory alkalosis? When I'm talking about alkalosis, you have to find out that the pH is more than 7.45. So pH is more than 7.45. So pH is raised. What will happen to carbon dioxide? That will be decreased. So how? I will give you one example. The patient have a condition as a hyperventilation syndrome, like hyperventilation syndrome. Hyperventilation syndrome. What will happen here? The patient is respirate quickly, so he will be inspirate and expirate quickly. In that conditions, more carbon dioxide will be going out from the body, and the carbon dioxide level will be going down and the pH level will be going up. So alkalosis will be happen. So due to these two parameters, we determined that is it respiratory alkalosis or respiratory acidosis. Look to metabolic causes. So metabolic causes, mostly the kidney will be involved in that. So how we will be find out is it a metabolic, and how will we find that is it a metabolic acidosis or alkalosis? It's very easy. When I'm talking about the acidosis, it means the pH is less. So here for the metabolic, we will be look for two parameters different from respiratory. Here the pH, here we look in respiratory, we look for the pH and for carbon dioxide pressure, but here we look for the pH and bicarbonate. So when we look for the metabolic, so in that cases we have to look for bicarbonate along with pH. So in acidosis condition, the pH will be down. And what will happen to bicarbonate? The bicarbonate level will be as well down, because we know the function of the bicarbonate. The bicarbonate function is in our body to neutralize the hydrogen. So when we less bicarbonate in our body, less hydrogen will be neutralized, and the hydrogen level will be going up in our body and the pH level will be going down. This is a mechanism that you have to learn that. So what condition is involving in metabolic acidosis? Firstly, lactate. If more lactate or lactic acid is produced in our body, metabolic acidosis will happen. If more ketones produce in diabetic ketoacidosis, so metabolic acidosis will happen. If more hydrogen produce or reabsorb in a kidney, so metabolic acidosis will happen. Like if the patient have renal failure, So the kidney will be not excrete the hydrogen. He will be lost the capability or the ability to excrete the hydrogen. So due to that, the hydrogen level will be going up in blood and metabolic acidosis will be happening. Due to rhabdomyolysis, metabolic acidosis will be happening. And as well, due to less bicarbonate, metabolic acidosis will be happening. We know that our kidney produce bicarbonate. So if the kidney does not produce enough bicarbonate, so metabolic acidosis will be happening. Or if the kidney, or in some situation like a diarrhea, we lost the bicarbonate. We lost more bicarbonate. We lost more bicarbonate and the metabolic acidosis will be happening. So these are the conditions that might be the cause of the metabolic acidosis. Come here for the alkalosis. When I'm talking about the alkalosis, especially metabolic alkalosis, it means the alkalosis is happened due to the kidney condition or some other condition that we will be talk about it, not respiratory. So you will be approached to the pH alkalosis. So the pH will be more than 7.45. What will be happen to bicarbonate? The bicarbonate will be raised in the body because the function of the bicarbonate, neutralization of the hydrogen. So in metabolic alkalosis, pH and bicarbonate will be increased. So how metabolic alkalosis will be happen in our body? If the patient have more vomiting, we know in kidney, the parietal cells, they produce the hydrogen. And if the patient vomiting, more hydrogen will be come out in vomiting and the body hydrogen will be going down. So due to that, metabolic alkalosis will be happen. Or if the patient kidney, if we look for aldosterone, if aldosterone is more produced, so due to that, kidney will more excrete hydrogen and due to that, metabolic alkalosis will be happen. When more aldosterone is produced, due to more aldosterone, the hydrogen will be excreted by kidney and due to that, the hydrogen level will be going down and metabolic alkalosis will be happen. What are that conditions? Conn's syndrome, or we say primary hyperaldosteronism. In a Conn's syndrome, more aldosterone will be produced and due to that, more hydrogen will be excreted by kidney. Liver cirrhosis may be the cause of the metabolic alkalosis. Heart failure may be the cause of the metabolic alkalosis. Loop diuretics may be cause of the metabolic alkalosis. In all of these conditions, more aldosterone will be produced and the kidney will be more excrete hydrogen. So now we approach to the cases, but you have to memorize these parameters. In a metabolic, we look for the pH and bicarbonate in respect for pH and carbon dioxide. So let's approach to 10 cases that how we will be find out. Here is a case 1 and the parameter is given pH is 7.28, it means it's less. So when the pH is less, it means it's acidosis. So look for another parameter. Look here for the carbon dioxide. The carbon dioxide level is 50. It means normally the carbon dioxide level is between 35 up to 45. So it means the carbon dioxide is more. And the normal value of the bicarbonate, we know it's between 22 up to 28. So bicarbonate is in a normal conditions or in normal level. So in that cases, we know respiratory is involved. And if we look here, that is what? Respiratory acidosis. So that is respiratory acidosis. Respiratory acidosis. I would like to explain the three conditions which is compensated, partially compensated, uncompensated here. Look for the bicarbonate. Okay, now the cause of this condition is respiratory. Look for the kidney. Is the kidney try to compensate that or not? Look for the bicarbonate. The bicarbonate is in a normal level. It means the kidney doesn't approach to this condition. So we will write respiratory acidosis and uncompensated. That's good. Look to the case 2. The pH is 7.51. So it means it's more than 7. So normal pH level is 7.35 up to 7.45. So the pH is high. It means alkalosis. It means alkalosis. Okay. Look to other parameter. Carbon dioxide. So carbon dioxide is 30. So when it's 30, it's less than normal level. It's less than normal level. So it means respiration is, or respiratory system is involved in that. Look to the bicarbonate is a normal range. So how we can say is respiratory alkalosis. Now you told me, is it compensated or uncompensated? Look to the bicarbonate. The bicarbonate is in a normal range, 23. So uncompensated. UNCM, uncompensated. Come to the case 3. Look to the pH. pH is less. It means acidosis. Look to the carbon dioxide level, 38. So it means it's in normal range. Because the normal range of the carbon dioxide is 35 to 45. So it's in a normal range. Look to the bicarbonate. The bicarbonate level is less. So what does it mean? It means kidney is involved and the condition is metabolic. So we will call it metabolic. What is that? Metabolic acidosis. So what did respiratory system, what did? Is it the respiratory try to compensate that or not? Look, carbon dioxide level is in a normal, so it means uncompensated. Uncompensated. So come to the case 4. Look to the pH. pH is more. It means alkalosis. Look to the carbon dioxide level. Is normal. and look to the bicarbonate, it's more. What does it mean? Kidney is involved. Metabolic alkalosis. So, metabolic alkalosis. Look for now, which you know that it's metabolic alkalosis, look to the respiratory. Is the respiratory try to compensate that or not? Is the range of the carbon dioxide is in a normal? Yes, it's in a normal range. So it's uncompensated. In a case 5, look to the pH. pH is in a normal. So look to other parameters. Carbon dioxide. Carbon dioxide is high, because normal level of the carbon dioxide is 35 to 45. Look to bicarbonate. Bicarbonate is as well high. What does it mean? It means mainly respiratory system is involved. Due to respiratory, because carbon dioxide is high, when the carbon dioxide is high, it means acidosis happen. So respiratory acidosis happened, but it compensated by who? By kidney. The kidney produce more bicarbonate to neutralize the pH. So it's fully compensated. Sorry, we have to look for the pH. pH is coming in a normal range. In that cases, we say fully compensated. So the main cause of the acidosis is carbon dioxide. That is the main cause. And that is the compensation. Due to compensation, the range is going up. Look to the case 6. You will be learn more of that. The pH is in a normal situation, in normal condition. Oh wow. Sorry, the pH is in less. So it means acidosis. Look to other parameters. So we know the pH is when the carbon dioxide level is going up, so the pH is going down. So it means respiratory acidosis. Respiratory acidosis. Look for the bicarbonate. Normally bicarbonate level is between 28 up to 22 up to 28. 22 up to 28. That is the normal value of the bicarbonate. So in here cases, the bicarbonate is slightly increased. It means the kidney want to compensate it, this condition, but he didn't still. He tried, but he didn't. So we called it partial compensated acidosis. If in that condition the pH is going to the normal condition, normal value, we will say that in that condition is fully, but no, now here the pH is less. He tried, the kidney tried to compensate that, but still they didn't. So it is partial compensated. Now look here to the case number 7. The pH is high, it means it's alkalosis. Okay, look to due to what condition that alkalosis happen. Look, is a 47. So normally we saying if the carbon dioxide level is going up, so the pH should to be down. It means carbon dioxide is not involved. Look to the bicarbonate. Bicarbonate level is high. It's more than 28. So it means bicarbonate is involved. So what we calling metabolic alkalosis. Metabolic alkalosis. So is the respiratory compensated or not? Yes, he tried. The respiratory system tried, but still didn't. So it's partially compensated metabolic alkalosis. Now look to the case number 8. The pH is less. So what does it mean? Acidosis. Acidosis. So look for acidosis. Okay. Which parameter is involved in acidosis? Firstly, look for the carbon dioxide. The carbon dioxide level is less. So normally we know if the carbon dioxide level is low, the pH should be going up. But here it's opposite. It means the carbon dioxide is not involved. So due to what condition that the pH is going down? Look for the bicarbonate. The bicarbonate level is less than 22. It means we have less bicarbonate in our body, and due to that the pH is going down. So what does it mean? Metabolic acidosis. So look for carbon dioxide. Is carbon dioxide is respiratory system try to compensate that? Yes, respiratory system tried, because here normal value of the carbon dioxide is between 35 up to 45. So now the pressure of the carbon dioxide is less than 35. So it means that respiratory system involved to compensate that, but still he didn't. Still the respiratory system didn't fully compensate it. So what does it mean? It's partially compensated. Now look to this case. pH is normal. So pH is normal. Look to the AB, look to other parameters. Which parameter is abnormal? So look for this ones. The partial pressure of the carbon dioxide is less, because normally it's between 35 up to 45. It's less. Due to that, the pH is slightly going up. So we call it respiratory acidosis. But look here, why I'm saying acidosis if the pH is normal? So how can I say that? Look for the bicarbonate. Bicarbonate level is 20. It means it's less than 22. So the bicarbonate, the kidney system compensated completely the condition, and the kidney maintain the pH in a normal range. So we call it fully compensated respiratory acidosis. So the last case is the number 10. you have to tell me that what condition is. Write it and put it in comment box and I will check that. This is all about the ABG. One thing more about the ABG that I would like to tell you, that we have another condition that we call it respiratory failure. How we can recognize that which type of the respiratory failure is happening. Normally we have two types respiratory failure, respiratory type 1 and type 2. How can you find that? So for that we have to look for oxygen, partial pressure of the oxygen and partial pressure of carbon dioxide, not pH. Okay, so in type 1 look for the partial pressure of the oxygen. If the oxygen level is less than normal and the carbon dioxide level is normal, so in that cases we calling type 1 respiratory failure. If partial pressure of the oxygen is down but partial pressure of the carbon dioxide is in a normal range, that is called type 1 respiratory. In type 2 respiratory failure, if the partial pressure of the oxygen is down and partial pressure of the carbon dioxide is going up or raised, that is called type 2 respiratory failure. So that's all about the ABG. I hope you learn the ABG completely.